All right, guys, thank you so much. So my name's Dan Salvadore. I'm a physician assistant here in orthopedic surgery at Monadnock. And my talk today is called Strong Steps, a seminar on fracture and fall prevention. So before we begin, let's first talk about why does fall prevention matter in the first place? Well, falls are incredibly common and dangerous, especially in older adults, often leading to serious injuries. The stats show in the U.S. about 1 out of every 4 adults over the age of 65 will have a fall every year. Falls are both the leading cause of fatal and non-fatal injuries in older individuals. And in 2023, over 41,000 older Americans died from a fall each year, with 3.5 million being seen in the emergency department. Now, I'm going to show you guys this graph. So this is over the last 10 years, the fall-related deaths in individuals over 65 has increased 53%. ED visits has increased 43%. So we look at the green bar and the green line. Now, if we compare that to fall-related deaths under the age of 65 in the last 10 years, it's only increased about 14%. ED visits decreased 21%. So what does this tell us? Over the last 10 years, we are clearly having a lot of falls-related deaths in both populations, over 65, under 65, but it's disproportionate for individuals over 65, right? And this is the last thing I just want to say to kind of really hammer home about why I think fall prevention matters so much. Once you have a fall, it results naturally in a loss of independence. Now that we have this loss of independence, we're fearful of falling again. Now that we're fearful of falling again, we're less active. But now that we're less active, we're going to have decreased mobility, strength, and balance, which actually increases our risk of fall. So you can see how easy it is to get into this positive feedback loop of this negative downward spiral. Falls will account for 87% of all fractures in the elderly, and 20% of seniors who suffer a hip fracture will die within a year due to the complications. And then very last thing to point out, the average age in America, the stats show, is about 39 years old. The average age in our community is closer to 60. So I feel like this talk is incredibly important for our community. So my goal by the end of this talk is let's find some actionable ways to try to improve your health, safety, and quality of life. So to transition, we first need to talk about bones. So most people think bones are a very static structure, but they're a dynamic living tissue. They have a complex interface between this hard outer layer of cortical bone and a spongy interior called trabecular bone. This interface allows bone to give support, structure, and also be lightweight. So if we look at the right, you can see normal bone, right? You have a dense network of trabecular bone. You have decreased dead space. Now if we look at osteoporotic bone, these gaps are happening in the trabecular bone, leading to these weakened struts, and you have a lot of dead space. So bones have a myriad of functions, right? So support protects our organs. They serve as a lever for muscles to attach to produce movement. A very underlooked quality, right, is the blood cell production. In our bone marrow, they produce B cells, T cells. They produce red blood cells, lymphocytes, and platelets. And then also they have mineral storage. 99% of our calcium phosphate stored in our bone, as well as carbonate, cations, anions. But the coolest aspect of bones is they have a very unique ability to remodel. They go through this constant ebb and flow cycle of bone breakdown through osteoclast and bone building through osteoblasts. This ebb and flow cycle allows us to respond to the daily stresses of life that we put on our bone and heal from them. So much so that there's a principle called Wolff's Law. Wolff's Law says that bones adapt to the degree of mechanical loading placed on them. So if we look at this right, you can see this is the proximal femur. This is a study showing Wolff's Law. And what it's showing is that the amount of tension and stress on the proximal femur will actually change the internal architecture of the bone, of the trabecular bone, followed by the cortical bone, to the degree of mechanical loading placed on it. Now, this goes both ways. If we are not using our bones, in that you can see that it can start to weaken that internal architecture. As we get older, there's a balance of bone breakdown and bone building. It starts to favor bone breakdown. So we want to do a lot of the steps we're going to talk about to try to attenuate that and help. So an interesting fact is that 90% of peak bone mass is acquired by the years 18 to 20, so in our youth, with most people reaching a maximum bone density at age 30. So this is important to understand, is that in our youth, we want to be doing as many things as possible to build up a healthy bone bank. right? So what do you want to do in your youth? You want to have good bone nutrition, calcium, protein, vitamin D. You want to partake in high-impact activities. Studies show that this can increase bone density by 1 to 6% in just a span of 6 months. So this tells us that individuals who are younger adults and children who are who do high-impact activities have significantly denser bone than their less active peers. As well, in our youth, we want to build up a really big bone bank by the age 30 so that we're setting ourselves up for success later on. It's kind of like in school, right? You want to do really good on the first couple of tests and cruise through the final. This is really the same thing. But as we get older in midlife and older age, about mid-30s, we start to lose a small amount of bone each year. Women will lose bone rapidly in the first 5 to 10 years after menopause due to dropping estrogen levels. And when I was researching this, I was always wondered why estrogen is so important for bone health. And it turns out that you have estrogen, binds to these estrogen receptors, and it inhibits this thing called rankle, which doesn't sound too important, but what it does is inhibiting rankle stops this osteoclast bone breakdown formation, and having enough estrogen allows this is called a mesenchymal stem cell to take these pre-osteoblasts and make sure they go to osteoblasts, so bone building. We don't have enough estrogen, nothing's inhibiting rankle, we have more bone breakdown, and that the mesenchymal stem cells, some of these pre-osteoblasts will actually turn to adipocyte tissue, so fat cells. Very, very important to talk about that. Hope is not lost. Lifestyle can slow or even partially reverse bone loss, and we're going to talk about some of this. And that bones will remain responsive to exercise at any point in our life, okay? And then really want to emphasize this study because it's a hallmark study. Regular strength training in postmenopausal women and older men has been shown to significantly increase bone mineral density in the spine and the hip, the two most common areas of fractures, right, in just a span of 6 to 12 months, effectively slowing or reversing age-related bone loss. Very important to stress on that. Now, quick healthy habits for all of us to just take away from here. We need to not smoke, we need to not drink, we need to maintain a healthy weight and make sure we have balanced hormones. And now even in our 70s and 80s, it's never too late to adopt some of these bone healthy habits, improve our balance, strengthen our bones, and help prevent falls. So we're going to talk really quickly about bone nutrition, about what's beneficial, right? So adults 19 through 50 years old need about 1,000 milligrams of calcium per day. Now that number increases by 200 milligrams if you're a woman over 50, men over 70. Now if you think about this, right, if we don't have enough calcium circulating through our body, it needs to pull it from somewhere. And we talked about earlier, where's all this calcium stored? Our bones, right? We don't want it to pull from our bones, so let's try to prioritize some good calcium sources listed here. Now this is vitamin D. Recommended intake is 600 IUs for adults up to 70. It increases by 200 for adults over 70. Important to emphasize, we live in New England. We do not have a 24/7 access to sunlight, so it might be more important for us to prioritize vitamin D supplementation or think about this. Studies show if we have adequate vitamin D levels, we're going to decrease our fall risk by improving our muscle function and balance. And if we have inadequate levels of vitamin D, it's linked to muscle weakness and falls. And then if you look at this super complicated picture on the right, all I'm trying to stress here is that at the top, this is showing how many different systems are involved for regulating vitamin D through here, and how many different systems in our body are responsible for regulating calcium. And they're two very, I feel like, underappreciated aspects, but we can prioritize these going forward. One that's more self-explanatory, right, is that we need to prioritize good protein intake. So adequate levels will help preserve bone mass and muscle strength. Low protein means that we're going to have potentially means we can have low insulin growth factor 1. And that's important because insulin growth factor 1 can promote bone formation and calcium absorption. Studies show frail older adults with adequate protein intake will often have lower bone mineral density and higher fracture rates. So we want to prioritize good protein sources. And then lastly, when we exercise, there's this uptick in like a protein muscle synthesis. So some studies show, maybe it's a couple hours you have this increase, maybe it's a day, maybe it's 2 days. I'm not sure if there's a clear consensus, but what we know is after we exercise, there is an increase of this protein muscle synthesis. So prioritizing protein after exercise will enhance bone recovery and muscle recovery. Studies show diets less than 5 servings of fruits and vegetables associated with lower bone density, higher fracture risk. So let's prioritize some of these nutrients listing here. For alcohol, more than 2 drinks a day increase fracture risk. More than 4 drinks a day, we double the risk of osteoporosis-related fractures. Now, something that I was surprised to hear about is that even high caffeine intake, more than 4 cups a day, can cause calcium loss in the urine, and it's been linked to a slight increase in fracture risk. Now, one of the most surprising things doing this talk was the pivotal role of sleep in bone health. So, short sleep, less than 5 hours a night, is linked to a lower bone mineral density and a higher osteoporotic risk. So you hear that and you'll say, okay, I'll just offset this. I'll just sleep a ton. That's still the wrong answer, right? Because it shows more than 10 hours, you're still linked to a lower bone mineral density and higher osteoporotic risk. If we have chronic insomnia, it will elevate some inflammatory markers and may accelerate bone loss. The cross-sectional study showed women over 50 who slept less than 5 hours had significantly higher odds of low bone density. And if we look at this chart over here, this picture, we can see there's a lot of things that can cause sleep disturbances and mess up our circadian rhythm. So when I say circadian rhythm, that's your sleep-wake cycle. You know, in the morning, we get up and we have an uptick of norepinephrine and cortisol. It gets us out of bed, makes us alert, and then that starts to drop as the day goes on. And then before bed, we have an uptick in melatonin to help us go to sleep. But if we look, there's a lot of things that could potentially be causing some of these sleep disturbances, such as hormonal changes, if we're fight or flight is too activated, inflammatory processes, when we're taking our medication or eating, or the amount of exposure of light that we're getting, right? So all things that can increase our fracture risk and lead to falls, and increase our fracture risk. Okay, so what we talked about already, right? Insufficient or disrupted sleep can increase fall risk. Fatigue, grogginess can lead to these missteps, right? And missteps can lead to falls, and falls can lead to fractures. Now, if we have untreated sleep apnea, right, the textbook symptom of sleep apnea is daytime dizziness. So that's something that we want to treat and prioritize. And as well as you got to be very careful if we're on sleep aid medications because they can raise the risk. Now, something I want to emphasize here and take time to just really go over is another hallmark study. Almost 300,000 adults with healthy sleep. So what does healthy sleep mean? We're sleeping 7 to 8 hours. We're not having frequent insomnia. We're not having excessive daytime sleepiness. They had a 17% lower risk of falls, a 28% lower risk of fractures over a 12-year period compared to those with poor sleep habits. This is independent of their baseline bone density. So these are some 10 tips for better sleep. Now, one of the most potent and important things we can be doing is going to be doing strength and resistance training. So exercise increases bone and muscle strength, improves balance, coordination, proprioception. It's going to cause your muscles to pull on bones, right? And it's going to cause this to stimulate bone growth and strengthen the muscles. Stronger muscles means better support and shock absorption for our joints. Now, we talked about this earlier, right? But I just want to bring it back. This was shown at that postmenopausal women, women who are postmenopausal or older adults who did regular strength training over a span of 6 to 12 months, increased bone mineral density. So this is something that I could come back to just reference, right? This is something important for all of us to go forward trying to do. So I think an actionable goal of all of us leaving here today is let's at least try to do 2 days of strength training, and we could prioritize compound exercises, right? So a compound exercise is an exercise that's going to target a lot of different muscles at once and stress our muscles and bones, right? So this can give us our best bang for our buck, right? So we're in the gym. Now this is with the caveat, if safely able to do so with proper form, right? But I think 2 days, if able to safely do so, is a great starting point. Experts recommend at least 150 minutes of moderate intensity aerobic exercise. Now, this doesn't have to be zone 2 jogging, right? This can look like a lot of different ways, right? Walking, gardening, dancing, and vacuuming. A lot of different ways to try to get to this, but this is going to help improve our bone density. This is also going to help improve our heart health. Now, another thing is balance and flexibility training. Numerous studies have shown that these type of balance-focused programs can reduce falls by 25 to 50%. And Tai Chi, when done regularly, can reduce fall rates by about 50%. So balance training is important because we're going to strengthen our hips, strengthen our core. We're going to improve our reaction time and proprioception. So if we put all of this together for an actual goal for all of us leaving here today, it would be great if we could aim for 2 strength sessions, 2 balance sessions, and at least 150 minutes of moderate intensity aerobic exercise. Now, we talked about this earlier. This should be appropriate for individual health status. And what I always say to patients is, right, we need to ensure safety and do a slow, gradual, progressive overload. We're not going to go from doing nothing to now doing all this at once, right? We got to gradually, progressively overload this in a safe manner, okay? Very important to talk about. Do you have, yeah?
So what are the modifications, not for home safety, but of aid on these recommendations? I mean, if somebody is 80,
Yeah.
you still want to do 2 strength sessions. Balance sessions is another story, but you know, is that still applicable, or do you have to modify it?
No, of course, right? As you get older in age, this is just a ballpark thing for anybody in the community to aim for. If you're older, or if you have different, say illnesses or different things, then you need to modify it to yourself. So that's why we're really trying to stress today a ballpark goal for everybody to aim for or reach. But if someone's older in age or if they have different things that's holding them back, then we need to limit that and still progress in a different way. So that's why really stressing finding somebody, whether that's, if you want to talk to, if you need to talk to a professional, trying to find what's right for you and doing that gradual progressive overload for the individual, okay? For this, when we're talking about is home safety modifications, we want to fall-proof our environment. So once we have a child, we baby-proof the environment, but as we get older and our loved ones are getting older, it's important to at least think about fall-proofing the environment. Now, a lot of these are a little bit self-explanatory, but it's really important to cover. If we're having a lot of clutter, let's reduce it or throw away loose rugs. If we're going up the stairs, let's not do it in the dark. Let's make sure we have adequate lighting, right? We want to make sure that there's a handrail nearby in the bathroom or on the stairs. We want to make sure we're not immediately going on the floors if they're just freshly waxed. And we want to make sure for our furniture arrangement is not a maze and we have clear walking paths. We want to prioritize assisted devices for ambulation if we need it. We want to make sure that we have medical alert systems, right? If we do fall, that we have something to call for help quickly. It's very sad when you hear individuals who are on the floor for a prolonged period of time and they can't call for help. So something to think about. Also for footwear, right? We don't want to be wearing the, fuzzy socks that could increase our risk of fall. It's just something to think about. But by addressing all these environmental factors, we're engineering out many of the common causes of falls. Now, getting into medications. So, for medications, the most common class you're going to hear about is something called a bisphosphonate. What they do is they slow down bone resorption over a few years to help stabilize or moderately increase bone mineral density. Clinical trials that showed that they increased spinal bone density by about 5 to 7% over 3 years. And very important to emphasize, they have shown to reduce the risk of vertebral fractures by 60 to 70% within 1 year, lower hip fracture risk by about 40 to 50% in treated patients. Now, who's a treated patient? This is going to be postmenopausal women or older men with a DEXA bone scan showing a T-score of less than or equal to negative 2.5, standard deviations from the mean, or with a history of fragility fractures. And in a little bit, we're going to talk about what a DEXA is and what a T-score is. Some of the newer classes of medication is Densimab, Prolia. This is an injected antibody giving every 6 months. Great option for people who can't take bisphosphonates or have reduced kidney function. Now, important to mention with this medication that if we stop taking, discontinue the use, bone loss can rebound quite quickly. And then there's a new class called these anabolic agents that stimulate new bone formation. And there's an even newer medication called Eventudy, and it's a monthly injection that both builds bone and slows reabsorption, can increase bone mineral density 10% or more at the spine at 1 to 2 years and reduce fractures, but they're typically used for limited durations due to their high cost.
Can I ask you a question?
Sure.
Is reclassed one of those agents?
Say that again?
Reclassed?
Reclassed.
R-E-C-L-A-S-T.
I'm not sure off the top of my head, but I could check for you. Okay. All right, now, as talking about adding these medications, if applicable, right, it's as important to talk about reducing medications that aren't needed or warranted, right? So it would be great for an actual goal of all of us going forward is to review their medication list with a healthcare provider, have a conversation about fall risk, Never stop taking your medications on your own, but in some cases, changing a medication that's not needed or warranted could reduce the chances of being dizzy or prevent falls. Now we're going to talk about what a bone density scan is. So this is something that's going to identify osteoporosis, osteopenia, and bone fracture risk. It measures the strength and mineral content of our bones. Now this is painless, it is quick, it's outpatient, it's usually 30 minutes. You lay on a table, they'll x-ray your spine and your hip. It uses a bone density scanner of 2 types of low-level radiation to interpret your bone density and gives you a score. These are all the patients that are advised to get a bone density scan, or all the individuals advised to get a bone density scan, and the only people who are not advised are pregnant, okay? Now, once you get that score, it's going to compare it, and it's going to be called a T-score. So this compares your bone density to someone who's healthy, 25 to 35 years old, of the same sex and ethnicity. And it comes back on a standard deviation. If you're +1 to -1, it's normal bone mineral density. -1 to -2.5 is osteopenia, meaning weak bone. And then more than 2.5 standard deviations is osteoporosis. And if you ever heard of a Z-score, what a Z-score is taking the same calculation of your bone, but instead of comparing it to a 25 or 35-year-old, it's comparing to somebody your same age, same weight, same sex, same ethnicity, okay? Now, we went over a lot of information today, but the most important things I want us to prioritize going forward is that we have some actual steps to think about. Make sure we're thinking about getting adequate calcium, vitamin D, protein, fruits, vegetable, not drinking, not smoking. We're doing 2 days of strength training, ideally, 2 days of balance training, ideally, and ideally 150 minutes of weight-bearing aerobic activity. We're going to fall-proof the home environment, talk to your PCP, see if you could benefit from a DEXA, maybe adding a medication, removing unwanted medications if needed. If we do all these things, we're setting ourselves up for success later in life to hopefully be fracture-free. And this is where...
Can I ask a question?
Oh, yeah.
Could you translate 2 days of strength training, where it says 150 minutes of aerobic? What's 2 days? What's the size of the length of a strength training?
Yeah, that's a great question. Yeah. So when I say 2 days of strength training, honestly, so this is the thing that it's going to come to a caveat of that it's individualized, right? What's a classic thing, right? So if you're somebody who's been exercising for a while or doing things like that, maybe 30 minutes is fine. But if you haven't exercised for a while, you might want to even just start with 15 minutes of weight-bearing activity. So this is the whole thing that I always talk about, right? If I prescribe a home exercise program, I always say maybe the first week we only do a couple, and the next week we go to 3, 5, 7, and we keep increasing each week. With an exercise program, I'm saying, I just don't want people to think that we have to be doing something 7 days a week. Would that be amazing? Awesome. I think 2 days a week is a great goal. In finding what you can tolerate and then slowly, gradually building from there is fine. If it's 15 minutes, that's still better than nothing. And then if you increase the next week to 20, that's fine. Now, this is an educational talk, not a medical advice, right? This is just an educational talk. But is there any benefit for us to be exercising with strength training more than 60 minutes? I'm not sure, right? A little bit outside of my wheelhouse, but I think the studies show cortisol is really rising past 60 minutes. So if you're working out, I would honestly say any exercise is better than nothing. And if it's 30 minutes, amazing. 45 minutes, amazing. And the 2 days could be 2 30-minute sessions, right? Something is better than nothing. Or if you want to do 4 days a week of 15 minutes, that's still 60 minutes, right? And then the 150 minutes of weight-bearing aerobic activity, that could be split up over 5 days. That could be split up over, it's the same thing. It's just a recommendation experts give.
I just have a question about vitamin D.
Yes.
I've heard that fish oil has vitamin D.
Mm-hmm.
Is it the same thing or?
No, so omega-3s, right, fish oil, right, you hear about omega-3s and omega-6s. Those you can get through dietary sources as well, and you can supplement with those. And vitamin D is, separate from that. So when you think about having a good diet, right, at Monadnock we have dietitians. They would be more than helpful, or they're great, and they can try to direct you about what sources dietary could increase our vitamin D and what could have good omega-3s. And if you can't get that through diet, then maybe supplementation would come into play. But no, so vitamin D and omega-3s are separate, but there might be some, relation between them and food sources and different things like that, or how they're processed.
So it may be a little complicated?
Yeah, just like if I was going to get a vitamin D supplementation over the counter, right, it would just be vitamin D. And then, like at home, if I have an omega-3, it would just be omega-3 and it would be concentrated omega-3s. So separate, right? But then when you take, if you had some type of dietary source, there might be, omega-3s, omega-6s, there might be protein in there, and that's where dietary sources cover a little bit more, but a supplementation is more directed.
But in the case, is it smart to substitute fish oil for vitamin D?
Yeah, so this is the thing, right? So is it smart to substitute vitamin D or fish oil? So this is the thing, right? So this is where we get into the thing of we're educational talk, right? Can't prescribe, right? Or say any medical advice for an educational talk. But this would be something that if we're talking about to our PCP, our general practitioner, and we got our levels tested and we're deficient in vitamin D, and you're saying, listen, this is the diet that I like, this is the diet I've been doing, supplementation would be, I would assume, very warranted, right, at that point.
PCP.
Yeah. If you have a deficiency in the levels, then getting supplementation would be more than warranted. But for an educational talk, it's hard to
Right.
offer any real medical advice. Yeah.
Did you come across anything about vitamin K being important for absorption of calcium?
In my research, I haven't, but that's not to say that that's not true. I just, when I was doing my research for this, I just didn't see that. But that's not to say that there isn't some relation. I just don't personally know of it. Yeah.
Lately, I've heard and or read that if you have osteoporosis, jogging is not recommended, but I noticed it's light jogging. How would you define light? I mean, is that, so just easy, you're not.
So this is a great question, right? So how would you define light jogging? So this is the thing, right, that was very encouraging to me when I saw this 150 minutes of moderate intensity aerobic exercise. It doesn't have to be just jogging, right? Gardening, walking, vacuuming, dancing, a lot of different ways, right? If you have severe osteoporosis, then you might have to find substitutes if applicable, okay? So what made me happy coming across that is the 150 minutes could be broken up over a lot of different things. And if you have 5 days in a week and you garden a couple days and then you're walking and you're vacuuming, it could be a lot easier to do that, because if you told somebody it's just zone 2 jogging outside, that's a lot harder to get 150 minutes of. But really, if we can get somewhere in that ballpark, the experts recommend that for bone health and heart health. Yeah.
So what's your recommendation to us or to your patients if we don't belong to a gym? Let's say we don't have a personal trainer and we're at all different health levels to do the strength training or balance exercises.
What would be great, right, is finding things at Monadnock, right? If there's, because I think we have exercise programs, but they might be specialized for different things. I think the next step for this is, now that you guys are very educated about fall risk and doing this, we should try to find some safe way to implement a safe exercise program for everybody to show the basics. Because if you're doing a compound exercise or doing any type of strength training, if you've never been to belong to a gym, it can be incredibly overwhelming, and you need to know how to do so with proper form. And this all is going to determine on where your baseline is, right? So I think going forward, it would be great if we could find something or build something together at Monadnock to try to find, now that you guys are educated, try to find safe and healthy ways for all of us to exercise.
At some of the towns around here have free yoga classes
Awesome.
at the library.
Really?
Yep.
Awesome.
Or the senior center.
Yeah.
It's pretty inexpensive.
Awesome. That's great to know. Yeah. Any other questions, guys? All right. It was great. Thanks, guys.